So hot in here. So hot in here.
We have all kinds of music about being hot, and there are many jokes about hot flashes, but they are not funny if you are suffering from them or if they're causing problems with your relationships at home or at work. Dr. Deena Horowitz is here with us to talk about new research on hot flashes, and I know you know all about this with the work you're doing at your women's clinic.
Yes.
So, Doctor, let's first talk about, when we talk about hot flashes and menopause, does it, as soon as menopause start, do the hot flashes start, or how does that work, the timing of it?
No, the hot flashes can start prior to, and there was a recent study, the SWAN study, 1,700 women in a 13-year period. And what they found was that if hot flashes started during your perimenopausal years, like in your 40s, they lasted much longer than for women who hit menopause and then had hot flashes.
Okay, so let's explain what happens. During menopause, basically your ovaries stop producing eggs, right?
Right, they stop functioning. Well, they don't totally stop functioning, but they stop producing
so your
eggs.
Estrogen levels drop off.
Right.
How is that related to hot flashes? Do we know?
We really don't know. It has to do with the hypothalamus, which is a small area in the brain that controls body temperature. And it may be more related to fluctuation in hormones than the absolute decline in hormones.
So when it comes to treating, with your patients, are hot flashes, is that, because I know there are other symptoms that come with menopause. There's incontinence is known to be a problem, right? Anxiety, sleep issues. Right. In addition to hot flashes.
Well, the sleep issues are probably, a lot of them are related to hot flashes, you know, and I think that one of the biggest problems with hot flashes is it disturbs our sleep. Yeah. You know, they start usually at night, and so you get these night sweats, you wake up, so your sleep isn't continuous. And the next day you feel a little cranky, and you're tired, and you can't focus as well.
And so it has this whole domino effect on your quality of life.
Absolutely.
So what do we do about hot flashes?
Well, what you do about them, the first thing you do is you learn to dress properly, and that means dressing in layers. Okay. You learn to avoid triggers, spicy foods, caffeine, alcohol. That glass of wine with dinner, you'll probably have a hot flash. So you learn what triggers are causing the hot flashes. The other thing that you can do is relaxation techniques, meditation, exercise, but not vigorous exercise, because that may bring on some hot flashes. Trying to eliminate the stress in your life, which is another trigger, which is always very hard for all of us. Yeah. And then there's things like medication. I mean, there are multiple medications that can help with hot flashes.
And do you know if you're having a hot flash versus just feeling a little warm?
Oh, yeah.
What happens to your body? Is it?
You actually you will feel this sensation of intense heat. And it's a flush, and that's why sometimes they're called hot flushes. Your face may get red, and then you start to sweat, your body is chilling off.
All right. When it comes to hormones with treating menopause, where are we with that? Because there's all these studies, and does it just depend on the individual woman and what your risks are for other issues?
Absolutely, absolutely.
It's so confusing.
The issue of hormones is way too long for this discussion. Yeah. But I think that it's an important discussion to have with your physician when you go into menopause, whether you're a candidate for hormones, whether you should be on hormones. What was interesting with this study, the median length of time was 11 years for hot flashes. The American College of Obstetricians and Gynecologists say that women should be on hormones for the shortest period of time, preferably 4 to 5 years. Well, that's not going to cover the time that most women have hot flashes, so that has to all be reevaluated. Yeah.
That's a long period of time to be dealing with this, too.
It is. It is.
Dr. Deena Horowitz, thank you so much.
You're very
welcome. What's the name of your
Center for Sexual Wellness.
That's it, Center for Sexual Wellness. Thanks for your information.